party was too long, I guess, yesterday. Let's get started today. But first of all and foremost, did you read the newspaper today morning? Did you see what happened yesterday? Okay. This is not AI generated, by the way. But for those of you who are interested in figuring out how this content actually made it, we spoke a lot about content yesterday, right? How this content was effectively evolved into a fantastic 3-pager. It's there on your app. Go down. I posted the content on what Copilot and ChatGPT together did to create details around these taglines. It's pretty simple and evident. So good morning once again. For those of you who are still walking in, before we get started, I'd like to take a few minutes just to introduce myself. My name is Vishal. I work for Axtria. For those of you who don't know Axtria, look it up. But most importantly, we're going to have fun today on trying to figure out what is commercial excellence going to be doing for pharma and AI and medical. Are we going to get around to solving the problem? The panel is there to decide this today, okay? So I'll let the panel introduce themselves as we get started.
Good morning, everyone. I'm Romika, Bhowmick. I'm heading external digital channels. In a nutshell, all the customer-facing channels at Teva globally. Nice to meet you all again today.
Hey, good morning. Met you all yesterday. Justin Molavi, head commercial strategy at Genentech, really focused on embedding AI and what we do in commercial.
Good morning, also from my side. I'm Bernhard Seiser. I'm the newly appointed VP for IT and Digital for AOP Health.
Good morning, everybody. I'm Mitesh Daftardar. I'm heading the Digital Innovation and Commercial Excellence at Merz Therapeutics.
Wonderful. So are you all set for today morning? I'm not going to ask difficult questions. The audience is going to probably ask the difficult questions. We've got to start, to get you all started today, we've got a small Slido, okay? Could you please bring up the Slido? A simple question, one word in English, okay? Not a combined word. If you guys can put up, what did you learn about AI yesterday? Okay. What was the main things that you learned about? Capture that in one word. I'm very curious to see what we learned, because yesterday's session was a lot about, if you read the headlines, talked about we are still thinking about AI. As pharma, we are still trying to get our words around what is going to happen. What will AI do to all of us, right? So please use your Slidos. Put your words in there. Let's see what the response comes out. Expensive. Ooh. Opportunity, possibility, unstoppable.
Hype.
I love that hype, okay? Engaging.
Change management is one word.
One word, apparently. No one understands
Hype.
AI.
So hype seems to be the biggest word of the day, I think. Probably most people have typed in hype. What do you think?
Yeah.
Is it a hype? Romika?
I wouldn't say so. I think it is also there. Future is also something that people have voted for, I think, close enough. Hype, yes, if you consider using AI without knowing what it means for the business.
Okay.
I think it's not about, I alluded to it even yesterday, if we use AI for the sake of using AI without knowing what's the business impact, how it will help your customers, how it will help your employees experience better, free up their time. We're not really, we are following the hype and not really looking at the future.
Good. So I'll kind of ask you two questions I have for you. And audience, please feel free. We'll leave probably 2 minutes towards the end. I'm watching the timer here, so we've got 18 minutes to get around with these questions. So I'll start with Mitesh, with you first. Where are we today with AI? Okay, and what is the promise it holds, and what is stopping us in pharma? It's important to understand what is stopping us. We are late adopters in the industry. Let's accept it. Okay, we are late adopters. What is stopping us?
Where do you want me to start? What is stopping us, or where are we? So I think let's start something on a positive note for a day. Like most of us, as we have established yesterday, are using AI, are aware of AI. AI is living next to us. So we know the importance of AI. We are also within the pharma industry. There are areas where we are successfully using AI. We have areas like R&D and drug discovery where AI is almost a norm, and we are also seeing a lot of successful cases. We are in the field of commercial. I heard that there are a lot of good pilots. I think from segmentation to targeting to predictive analytics, we see there are a lot of good examples, and that's where we are today. So we, as pharma, are an industry of pilots, right? So I think from this point, we really need to step up our game. What was my second question? What is stopping us?
What is stopping us?
I think it's just us stopping us, right? Here I would like to draw parallels to other industries. So yesterday we have established the fact that we are an industry of silos. So whereas when you look at us compared to other industries, it's not a nice to have, AI is a must have where you go, because a lot of insights that we get, they feed into the R&D processes. So compare us, for example, to a Coca-Cola or a consumer health company. Yeah. The commercial teams actively go, ask for the customers their insights, they build a whole insights platform, and that builds into the R&D model how they design and develop new products, because the cycle is very fast. I don't think we are there yet as a pharma. And I think we are really siloed, because what a commercial team does today, an R&D team does, and there is medical somewhere in between, those silos don't help us really leverage on what the possibilities of AI are. And I think we should draw parallels and learn more from other industries, how they effectively use AI.
Awesome. Bernhard, do you feel what he's saying is right?
It's totally spot on, so I fully support that. You brought up a couple of good examples where AI is actually already helping us, also in the commercial space. But I see the adoption within commercial is not as high as in R&D, and it might have different reasons. So I think predominantly it's the lack of understanding. People showed this also on the slide. Like, what is AI? What does it mean for the business? What does it mean for the sales force in particular? Because does AI really work on the ground? That's the big question. And that's what I don't see happening, to be honest. But it's also a matter of convincing the folks that commercial excellence, with all the tools that we now get from AI or machine learning, and you name it, that this is correctly deployed. But also putting an emphasis on explaining why this is helpful for us. I don't see the right level of adoption in our industry, especially in commercial. And there we have a lot of things to do and catch up.
Audience poll, raise your hands if you feel we are not doing enough in the commercial space. 1, 2, 3. There are a lot of them who are saying that we are doing a lot.
A bit.
Interesting.
Nice.
Justin, you brought up a point yesterday about, we are still scratching the surface, or we are putting the things together, we are building the blocks together, right? There was a lot of conversation yesterday about data, right? Do you feel that's a kind of a pertinent challenge that's there with us today?
Beyond the challenges that the panel was we're talking about, I'd like to add one too. We live in a world where commercial excellence is a nice to have, it's a must have, and AI is an enabler. With data, as an industry, I don't think we treat data like technology or the tech industries. Mm-hmm. We don't have, some of us may have data engineers, but we don't really focus on how do we get the data into a particular place so that we can ingest and use it. It's not something that's readily understood by executives. Hey, we buy the data, it should be fine. That's just the surface. There was a Adobe presentation earlier where they looked at the content operations map.
Yeah.
We need to look at the data operations map and really understand it and put resources behind it, as opposed to, I may do data strategy, I buy the data and it sits there, as opposed to, how do we create products for our internal customers to be better at what they do, whether in the field or whether they're marketing to their customers digitally.
So you still feel data everywhere, not a drop to use? That's interesting. Interesting perspective. Romika, what about you? What do you feel? Where are you on your journey within Teva today?
I think it's a lot around experimentation. So, start small, like, we mentioned earlier about, pilots. Start small, partner with affiliates on what is the use case that can scale to a larger, we can share it with the other markets and affiliates to really make sure that this sort of recommendation or prescriptive analytics is working. And we try to drive scalable use cases, but first seeing the success at 1 or 2 affiliates, if it's working, and then sort of really using them as the champion to sort of make sure that we can scale. And I'm actually pleasantly surprised that even at the market level, there is this know-how that we are building across around the company, around AI and generative AI as well, how best they can solve their own, business operations and efficiencies around to enable them to do their job better, whether it's at the field level or whether it's the marketers who are working in the, content, generating content. So there are quite a few use cases which are coming up and now, and which are to be seen how successful they are, and as they are in the stage of implementation, and then to scale. So at this point, that's where we are. But however, I would totally agree with Justin. The data part is a very key. Getting your data in order has been still quite a big challenge in the organization, and we are still working on it to create a big foundation, because we cannot have good use cases running, automation running, without having the data in the right shape and form that we want to really digest it.
So it's a paradox, right? You need the data to prove the business, but you don't have the business, so you can't get the data.
Exactly.
You're kind of stuck in the loop there.
Stuck in the loop.
Interesting.
And there's one thing I'd like to add to your point. One, use cases are very important, and building from the customer pain points, whether they be affiliates or marketers in the US or whoever your target audience is, and using a product model. So we can't solve all the data issues because they're just extensive. We'll have vendors tell us that they can. But by having one product and saying this is going to, on the back end, the data is going to be okay, our customers' pain points are met, we're activating it with change management, that model seems to work.
Interesting. So coming back to, I know we are all in experimentation. I mean, we saw that coming out. We are all experimenting with AI. I mean, honestly said, it's just still 2 years. We are still rolling out CRM for some of our customers. We are still implementing basics. I don't come from the industry. I spent a lot of time in automotive. So, to me, when I came to the industry, it was like a shocker. I mean, me and Bernhard were talking about it earlier. So if you have to start looking at real use cases, both on the medical and the commercial side, right? And I'm still calling them commercial and medical because that's what it's still separate, but in the future, I don't think that line is going to exist. But what is the one real use case that you, within your organization, want to pick and run with?
Okay. I think one thing I've established over the last days is data, as we said, is very important. However, what is bringing us data in the commercial area? It's data coming from different channels. And where is data landing? It's mostly, at least in my company, it's in our CRM or a data lake. Let me ask you, how many of you are actually happy with your CRM, or you say, oh, my CRM is perfect? Can you raise a hand? One.
How many?
One,
Nice.
two.
Let's chat.
All the CRM guys from Viva and Salesforce.
Salesforce guys, you should need to listen.
Salesforce and Viva.
Salesforce guy, okay. How many of you of those are working in pharma? Right? There you have the...
There's one.
This one is back.
Sorry, I don't... Okay, let's have a chat. I would really be interested to learn. And I think one of the clear use case, what our customer-facing functions always say is, oh, your CRM is not user-friendly, we cannot use it. They're giving thousands of excuses, right, why not to use, rather than find one or two reasons how we can improve the quality of data coming through our CRM. If we are able to make life easier for our sales teams and automate processes for input and also getting something out where they don't have to work through hundreds of dashboards to make their decisions. I think this is one of the clear use cases where I see where we can probably solve years of issues that we have and these questions. When I joined the pharma industry 15 years ago, we had the same question, and now we are facing with the same question. Why don't we start there?
Bernhard, you are just coming into your new role.
Exactly. Yeah. And we have a fantastic CRM. No, of course, data is an issue on our side as well. They are not using it. But for us, I think where we're going to start using AI is definitely on understanding our customers. So identification of key opinion leaders.
KOL identification.
Really finding a way to approach these customers in the right way. To be fair, our company, we don't do proper omni-channel marketing yet. Yeah. So on one side, that's good because we have a clear focus on face-to-face and more the customer engaging channels. But we'll definitely move and shift towards digital channels in the future, and their content is key. And there, Gen AI is super. So
Interesting. So KOL identification and content. You are still stuck on the data, trying to figure out if the CRM works.
Absolutely.
Good. I like it. Justin, what about you?
A couple of use cases that we're working on. One, which is very successful, is our next best action. We have high acceptance rates where we're using AI in the background ML, to suggest physicians and particular messages to serve up to particular customers. But I want to step back a little bit. All of these use cases are not really useful if we don't understand the impact of our actions. For instance, we live in a world where it's revenue versus forecast, not whether our channel has a high ROI, not whether our field force has a higher ROI than it did before. But without establishing those incentives and base, it's going to be harder to roll out other types of technology to our groups because we need a process and incentives change, which we're working on.
So you mentioned, I think somebody mentioned yesterday, we love putting shiny tools in front of our field force and our commercial and our affiliates.
And we beg that they use it, as opposed to creating it with them and starting with the pain point.
Okay. How's things at Teva?
I think all the same kind of issues, challenges as well. But at Teva also we are also balancing generics with innovative, how we want to target. And an interesting insight which we were talking about yesterday as well is to drive patient centricity, right? So if you want to close the gap between commercial and medical, slowly, I think we need all the enablers and the data points to make sure that we are having the patient at the center of the journey entirely. And to close that gap, getting closer to the KOL identification, HCP profiling, getting all the right feedback from the patient journeys to actually feed into this, I think is the key and the future. And we are working towards building that ecosystem at this point.
It's interesting, two people mentioned KOL identification. How many of you believe that KOL identification is actually going to be helped through with AI? Okay, interesting. Do we need AI to solve that problem, or is the rep just better off knowing who is the right KOL for you?
So I think AI should be seen as an enabler, essentially, to quick establish the result that you expect. But we have been in this space for a long time. For example, look at forecasting. We have solid forecasting models. AI can support that. Same can it do the trick for a KOL identification. So I guess that definitely works. I think in all spaces we can use the tools, the new tools that will come up in order to be quicker at achieving the results.
I just like to add one point. This is the key example of really having commercial and medical coming together really also in this, like bridging the gap. Because, there are, cases where we've mentioned medical is not ready to adopt digital.
Front bencher
Yeah,
doesn't
I know. He mentioned, dinosaurs yesterday. But not to be fair, I think it's about getting that right leadership buy-in and getting the teams together there are multiple stakeholders involved to really ensure that we have a patient-centric approach. And I think to drive that, adopting AI as an enabler and looking at it as an inevitable enabler for us is key. And I think that's how we see it also.
So we heard KOL identification, I heard NBA. Mitesh is still trying to solve the data challenge, but we know that. The CRM issues are still around.
Yeah.
Okay. What are we going to do about circumventing these? We've got, probably 2 minutes to catch up with you. So, if you had to pick up one area, Mitesh, what would you do?
It will be like a broken record, and I'm going to say it's change. Change as in mindset, and I would even go as far as saying that change your organizations. We cannot operate on structures that have been in place for 50, 60 years in pharma and expect to adopt suddenly new technologies and work like a tech company. That's just not going to happen. I would start with change.
Bernhard, what about you? One thing.
Hype was the biggest word written on the previous page. Managing the expectations. I mean, one of the reasons why we're discussing issues that we have with AI, or why are we not there in utilizing the full potential, is because also our management or our boards expect us to deliver on AI without them really understanding it. So that's...
We are recording this session, you know that, right?
I know. So that's for me critical. Besides, of course, what was mentioned before. That's
Justin, one word.
I'd have to agree with Mitesh here. I know that we're running out of time. Process and incentives and changing our organizations. This is another digital transformation. We're talking about AI, but we're really talking about transforming our companies to be better at commercial.
Processes, incentives. Does that ring a bell? Anyone in the audience? Processes and incentives. Are you wanting to realign those things?
Can I ask one question to the audience?
Yes, go ahead.
How many of your companies are actually incentivizing your employees or even customer-facing teams on real customer experience, on improving net promoter scores or adopting a certain... let's have a discussion then. Yeah, I mean, I think let's meet such people and let's talk to them and let's understand how are they doing great things.
Interesting. Romika, one
I
word.
would say agility.
Agility.
So all of that we can summarize if we say that building that agile mindset in the organization is important because times are changing. We need to adapt, realign our processes, and technology will always move faster than us, how we adapt it, but we have to be open to change. I think that's more important. And I think that would sum
So
it up.
failing fast is what you're saying.
Absolutely, and also being
love
open to changing.
Do you all agree we want to fail fast in adopting this technology and not wait 5 years, 7 years for a CRM implementation? See, nobody agrees. We still want to be with our old ways.
They do agree. They're just a little tired.
Just a little tired from the party, a lot of partying. Dario, we need to change the day of the drinks, okay? Wonderful. We've got time for an audience question, something which is really itching anybody. Okay, go ahead.
Brian?
Oh, no.
Yeah, I think I would just ask, what is just one solid use case right now from either all of you or one of you of a practical application of AI in commercial excellence and how it's improved some part of your organization?
Justin, you had a very valid point there. Go ahead.
On the next person.
We've actually increased revenue through next best action, delivering this to our field force, suggesting HCP and brand to talk to. So we have high acceptance rates. We also have leadership asking people to accept these and act on them, and we actually see revenue impact as a result.
Thank you.
Yeah.
We've got 30 seconds more. Anyone for a fast question? I think no question. That's good. Thank you so much, everyone. Thanks a lot. Thanks for the audience.
Thanks, everybody.
Thank you. Good morning.
Thank you.